Okay, so let's talk a little bit about the signs and symptoms that we need to be looking for in our athletes. Now, there's two different ways that we want to actually talk about this. We want to talk about it from an athlete's perspective, but then we also want to talk about it from parent or a coach perspective as well, because we're going to see subtle differences between the two depending if you're looking for a concussion in yourself or if you're looking at your child or one of your athletes for a concussion. So let's talk about it as a concussion from the perspective of the athlete. Typically, when we have concussions, we'll see a number of different symptoms: headaches, loss of concentration, trouble focusing, memory loss, as well as confusion, sensitivity to lighter sound, or different things of that nature. So when you're an athlete and you're deciding whether or not, maybe I sustained an injury to my head, see how you feel. If you black out, that's a good representation that this may have happened. If you can't remember plays when they're being called, or you're having a hard time with your homework or your studies when you usually don't have these issues, you may want to see a professional or tell your coach, tell your parents, and get checked out. Now let's talk about it from a coach's perspective. This is probably even more so important than it is for a student athlete catching it themselves. And the reason being is we're the ones responsible as the coaches or as parents to make sure that we're not allowing our kids to be injured or anything like that. So when you're a coach or when you're a parent and you're wondering whether or not your child sustained some sort of injury, see if you notice any changes in their moods or changes in their personality. Have they been acting a little bit more tired, a little bit more fatigued, a little bit more depressed? These are some of the things that you may notice. See if they're having trouble, again, same thing with school or during practice. If they can't memorize plays, or if they're not able to do their schoolwork, or they forget assignments that they had. These typically are things that are sustained with TBIs or concussions. Also, take a look at their looks. Do they seem dazed or confused? Are they able to focus their eyes on you? Are their eyes kind of wide and open with like a off in the distance look? Or are they narrowed and constricted and focused on you? These are other things that we can look for in our athletes.